Hello and welcome back. I'm Nurse Alyssa, and today we're going to be going over prevention and management of minor skin traumas at home. But first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel grow. So let's get started. So who's at risk for skin injury? So minor skin injuries are preventable, but they do happen. For most people, minor skin injuries, they don't cause major problems, but for certain individuals, minor skin injuries can lead to more serious discomfort and serious health problems. Now, we'll go over some of the reasons that can increase your risk for skin injuries. So, certain activities, either at work, home, play, can put a person at higher risk. So, things that involve sharp, hard objects or tools, fast moving objects, can put your skin at high risk. Now, fragile skin, so newborns, their skin is more fragile than, say, an older child or an adult. So they're more at risk for more skin injuries. Now, elderly, as we get older, our skin starts to thin. So they can get skin tears a lot easier. So it does put them at higher risk. And then just your general health. So because our skin is an organ, it is affected by a person's general health status. So things that could make them more at risk would be, say, chronic disease, critical illness, such as rheumatoid arthritis or cancers, certain medications, such as steroids or anticoagulants, and even poor nutrition can increase a person's risk. Now, even general health. So, with diabetes, people tend to get neuropathies or their sight isn't as good. Their feelings, they just can't feel properly the sensations such as heat, cold, pain. So that does put them at increased risk for skin injuries. I always like to go back to my one patient that I had. An older gentleman, he had diabetes. Now, he always knew that he had decreased sensation in his feet and legs. So he had kind of pins and needles sensation. Now, with that said, one night he said his feet felt really cold. So he put a heating blanket on them. He had a radiant heater at the end of his bed to keep his bedroom a little bit warmer, and he went to bed. He did this multiple times, never thought anything of it. So in the middle of the night, he had kicked off his blanket because his feet had got hot. He didn't wake up, and his foot went in between the radiant heater. Now, because he could not feel the heat, the pain, his foot got burnt very, very badly. It actually went all the way down to the bone. When he woke up in the morning, that's when he had noticed how bad the burn actually was and noticed that he even had a burn because he was not aware of this until he woke up in the morning. So your general health, it can definitely increase your risks for serious injuries. In his case, he did lose a toe. I mean, I'm shocked that's all he lost because all of his toes were pretty badly burnt, the tops and the bottoms, but one toe got it the worst. And then lastly, our balance and mobility. So poor balance and mobility can put a person at risk for falls or bumping into objects. So that does increase the risk of skin injury. So here we have all the different types of skin injuries that we can obtain. So we have bruising, which is really a bleed underneath the skin. We have scrapes. We have burns. We have skin tears, we have puncture wounds, and we have cuts. So how can skin injuries be prevented? So creating a safe environment is very, very key. I used to work in home care, And this was a major thing for me because you have to always be looking around, visualize, because you wouldn't even sometimes think, but a lot of elderly people, they like to have these like rugs everywhere covering their floors. And that's a tripping hazard. And they're already at increased risk for skin injuries. And then we're adding these tripping hazards on top of it. So we always have to be cautious about our environment. So we want to create that safe environment. And so have a look around your home, work, or play environment and take special notes of any sharp objects, pointed objects, hard surfaces, rough surfaces, tripping hazards, slipping hazards, and just remove anything that you can. So if there's something sharp or a pointed object that we can like either turn around or prevent that from, if somebody falls and is going to hit it, if we can prevent that, we need to do so. So just make sure that we're removing any hazards and ensure that areas are well lit so they can be seen. And even at night, if we have those little lights that can just be plugged in, and have a few of those around the house so it is slightly lit up while we're, because elderly, they like to go to the bathroom a lot at night, or even young children. They need to be able to see where they're going. So if we have those little lights that just kind of turn on when it's dark in a room, that's perfect. Next, we want to protect our skin. So if we're doing activities that can cause injuries, if there's equipment that we can wear or protective clothing that we can wear, we want to do so. Okay, even with skin tears. So if we're noticing that, say, our elderly patient or elderly grandparent are getting a lot of skin tears, there are actually Derma safe sleeves to protect their arms and legs that they can wear. It's just a simple sleeve. And then if they hit, it's going to hit that and it's not going to tear their skin. It's just that protective layer over their skin. But even like a loose long sleeve shirt, I know it can be hot in the summertime, but just one of those thin button up sleeves, they tend to work perfectly. I mean, there's still chances that they are going to get skin tears, but if we can minimize, that's what we're trying to do. Next is just maintaining good skin health. So what we're going to do is just use a pH balanced soap for cleansing. We want to moisturize twice a day. So when we moisturize our skin, it's hydrating our skin and giving it a little bit more elasticity. So when we have that, it's less chances of skin tears. So when our skin is really dry, you're at higher risk of skin tears. So we want to make sure that we're moisturizing, especially after a bath. So when we are done showering or bathing and we pat our skin dry and it's still a little bit damp, put on that moisturizer and it just locks in that moisture, okay? When we're showering, we're using warm, not hot water. And then making sure that our fingernails, our toenails are cut and filed well, and just ensuring that our clothing fits well and covers exposed at-risk skin. So like I said, with the long sleeve shirts, if they're always getting skin tears. So what do we do if we get a skin injury? So for bruises, first we're going to, if we hit an area and we just know that we're going to bruise, we're going to apply ice to the area to stop the blood flow to the injured site, okay? So this limits the size of the bruise. So you're still going to get a little bit of a bruise because really what a bruise is bleeding underneath your tissue. So it didn't break the tissue, but blood vessels underneath got damaged and are bleeding underneath the tissue. Now, if we just apply ice, it slows down the blood flow, allows it to heal, okay? With scrapes, we're just going to cleanse the scraped area, some soap, some water, cleanse any debris like dirt or gravel. Once again, we're not using hydrogen peroxide because that can cause, it's toxic to the tissue, so it can cause more damage to the good cells. Just soap and water, that's all that's needed. Now with cuts, we're going to control the bleeding by applying gentle pressure to the wound with gauze or clean cloth. Now if you're unable to control the bleeding, it's not stopping after 10 minutes, you're going to want to go to your local emergency department. Stab wounds. So you're going to apply pressure with a gauze or clean cloth once again to control the bleeding. If you're unable to stop the bleeding, go to your local emergency department. If it's not really stopping within 10-15 minutes, you should be going. Now, if it's with stab wounds, it's hard because if it kind of went in and came right out, okay, it is out. But if something is stabbed and it's something large, we should never remove that. We should always go to the emergency department and have them remove it to control any bleeding. Because if it is in deep and it is stuck in there, we do not want to pull that out. Okay, we don't want to be pulling that out at home. Skin tears. So with skin tears, we really want to, if that flap is still on there, we want to move it back into the position where it was if we can. So we're just going to be using a moistened cotton swab to put that torn area back to the normal spot as much as possible, because it will tack back on there. And it's the best way to prevent infection, is just tacking that back on there, covering it up. And then with burns, so with a burn, we want to run cool, not cold, just cool water over top of the burn site for 10 minutes, okay? This will minimize the extent of the burn because we're removing that heat out of the tissue. We've all had burns before. So say you're cooking, you get a burn, you throw it under cool water, and you throw it on only about 2 minutes, and then you pull it out and you start doing things, and all of a sudden it starts burning again. It's because that tissue has heated up so much. We need to get that burn, that heat out of that wound, and it takes about 10 minutes. So you know what, just run it under there for that 10 minutes, reduce the damage, reduce the extent of the burn, and it will help you in the long run. So I did just add here with skin injuries, when you would possibly need to go to emerge or get professional help. So if it's really deep, this could involve blood vessels, nerves, tendons, or bone. We want to make sure that we're having this looked at. If you can see white in the base, that's bone. We should have it looked at. If we have exposed muscle tissue, so this is going to be red, or fatty tissue, which is yellow. If it's deep, we should have it looked at. If you're holding like both sides of the wound and it just keeps like flapping back open, you can't really get it to close together, like kind of tack shut, or with a bandage, it's not staying shut, you might need stitches, so you should get professionally seen. If there is visible dirt after you cleanse the wound, so if you cannot get that dirt out, I have seen this in road rash, so somebody on a dirt bike or a motorcycle and go flying down the road, something happened, they wiped out, and there's little stones that they can't get out. You should be going and seeing a healthcare professional. If the bleeding's lasting longer than 10 minutes after you have applied pressure, go to the doctor. Or if it becomes infected, okay, we need to be getting that looked at right away. Okay, so next is how we can tell if a skin injury is infected. So a wound that is healing normally will normally stay closed and get smaller in size over time. If you keep the area clean and protected, your chance of infection is quite low, okay? So I always like to say, we're not using antimicrobials or antibiotics until you have an infection, okay? More is not better in wound care. So until we have infection, it's best to keep those away. So some signs of infection though. So increased discharge or pus, in the wound, if you have a fever or the wound feels warm, if you have increased pain, increased odor coming from the wound, increased redness, swelling, warmth around the area. Anytime there's an increase in anything with that wound, we want to be getting it checked out for infection by a healthcare professional, okay? So that's all I have for this video. I hope you did find it helpful. And if you haven't done so already, if you could hit that subscribe button, it would be greatly appreciated. And I will catch you all in my next video. See you guys.